Good morning. Thank you so much for being here. And I just want to start off by thanking Rich Gibson and the entire team in the state's attorney's office, our police, our health department, corrections, our sheriff's office, our public defender's office. This was a collaborative effort. So when you see State's Attorney Gibson, when you see JAMA with our corrections, Marcus Harris, our sheriff, Chief Myers, Dr. Rossman, everyone came together because we know it's our responsibility as a community to evaluate and improve our public safety initiatives to ensure that we are providing the best possible outcomes for all residents throughout our community. This innovative, thoughtful, and proven LEAD program is a more effective public health-based approach. And in this instance, the program is vital in identifying the root causes of nonviolent crime and providing the resources necessary to reduce further harm. We have the opportunity to change the way criminal behavior related to problematic substance misuse disorder, mental health, chronic homelessness, poverty, and other health and wellness issues is handled. Per the LEAD National Bureau, the program has reduced recidivism of its participants by nearly 60% and has an average cost savings of around $3,000 per participant in LEAD versus the system as usual approach. Instead of facing the system of booking, detention, prosecution, conviction, and incarceration, individuals are referred to our health department where they can receive a range of support services, including substance use treatment, physical and mental health support, housing, education, and employment. We remain committed to supporting safe communities and promoting opportunities for all individuals and communities to realize their full potential and become their very best selves. Again, thank you to our partners throughout Howard County for making this a priority, and we look forward to seeing the positive outcomes in the lives that are transformed for the better in current and future generations. Thank you.
A few months after taking office in April of 2019, I met with a representative of the Governor's Office of Crime Prevention, Youth and Victim Services, and a friend of mine, Ramel Showell, who is a public defender in Baltimore City. They came together and informed me of the LEAD program, which had previously been in operation in other areas throughout the state and country, and I immediately saw the potential for implementing this program here in Howard County. What is great and sort of unique about this space and a true benefit to our community is that we have leadership in every aspect of our government that is willing to work collaboratively for the benefit of all. We have in place an MOU signed by 7 different entities: the Department of Health, the Police Department, the Sheriff's Office, Public Defender's Office, Department of Corrections, County Executive's Office, and the State's Attorney's Office. And so while this program's inception began with the State's Attorney's Office, it is truly a collaborative effort because each of us can see the positive impact that the LEAD program will have on our community. As a prosecutor, I know the justice system is a powerful tool in maintaining order and impacting lives, but it's not a perfect tool. Sometimes people just need help, and the justice system is one way of getting individuals the help that they need. However, that approach does have cost, financial cost borne by taxpayers, societal cost borne by the particular person interacting as a defendant that they will have to carry for years to come. Those collateral costs can be debilitating. To be clear, there are times when individuals' actions deserve and demand the full weight of our justice system and all the collateral consequences that come due to the choice they made to violate our laws are fine. However, the LEAD program offers an alternative, one that bypasses the formal criminal justice system and thereby does not saddle the potential defendants enrolled in the program with an inability to qualify for certain business loans, doesn't create limitations on future employment, doesn't create limitations for public housing assistance, would avoid limiting their career options, and would not inhibit them from joining the military. In short, those selected for this program will be offered an opportunity to change the trajectory of their lives without being saddled with the collateral consequences of the traditional justice system. This is how it will actually work. Participant will be referred either through social contact or law enforcement contact for the enumerated offenses. They're all misdemeanors or lower-level offenses. Police will run a record check and make contact with the lead program case manager to ensure the person is suitable for enrollment in the program. If, based upon a law enforcement referral, the officer will transport the participant to the detention center, where the participant will be handed off to the lead program case manager. This is very important because it allows the officer to quickly get back out onto the street and be redeployed for more serious matters if they were to occur. The lead case manager enrolls a participant in services unique to their needs and their situation. It could be mental health services, substance abuse treatment, housing services, family mediation services, educational services, employment assistance, medical assistance, or any combination of the above. The lead operational work group will then meet on a regular basis to monitor and discuss the progress of the participant through the program. We have the benefit of having state funding for the program, sufficient to fund the program for 3 years, received a grant, specifically funding Howard County's lead program to the tune of $530,000. In conclusion, it speaks volumes that so many agencies are uniting to launch this program, which is designed at its core to help people in our community when they need it most, and offers us the ability to attempt to address the root cause of problematic behavior without exposing the participants to draconian consequences. We look forward to implementing this program on behalf of our community, and I'm deeply grateful to my partners for helping to get this done. Thank you.
Good morning, everyone. I'd like to first start by thanking our state's attorney, Rich Gibson, for bringing another collaborative partnership to the table where we are able to offer more restorative justice programs to our community, and to our county executive, Calvin Ball, for always being supportive of our initiatives. Policing is so much more than making arrests. Today's policing is about providing access to services that offer members of our community the best chances for rehabilitation instead of incarceration. Here in Howard County, we are focused on the benefits of restorative justice and recognizing the value in reducing interaction with the criminal justice system whenever possible. We have many strategies at the police department to address the root cause of crime. From mental health opioid addiction, we know that there are behavioral issues that must be addressed to deal with the cycle of illegal activity. LEAD is just another tool in our toolbox. This program will enable police officers to offer an alternative that can address the root causes of criminal behavior. Under the appropriate circumstances, officers can make a referral to the LEAD program instead of filing criminal charges in some misdemeanor cases. It is reassuring to know that with this referral, our officers can offer direct access to substance abuse treatment, mental health care, housing services, employment options, and peer support. Addressing these needs can help prevent future crimes in our community. And while it is our job to enforce violations of the law, our first choice will always be preventing those violations from happening in the first place. We have seen great success with our youth diversion programs for many years and are glad to be able to offer that same option now to the adult population. Our goal is to offer services that will best support each individual's needs. LEAD can help change the course of someone's path before they head in the wrong direction. We are glad to be able to offer this program in Howard County, and I am grateful to my community and law enforcement partners for working together. Thank you.
Good morning, everyone. As prior speakers has mentioned, this is really a great partnership and community effort that's been many years in the making. So thank you to the county executive for supporting all of us in our endeavors, Chief Myers and Mr. Gibson. And last but not least, the behavioral health, Howard County Health Department staff for working with everyone to make this happen today. LEAD is a powerful tool for our behavioral health experts to use as the health department continues its mission to provide accessible health services to everyone in our community. This program breaks down the silos between law enforcement, health services, and government and ensures that individuals receive the care and support required to address unmet behavioral health needs. A harm reduction philosophy is one of the core principles of LEAD. Participants will be engaged based where they are in their lives and in their drug use and recovery. They will not be penalized or denied services if they do not achieve abstinence. The goal is to reduce as much as possible the harm done to themselves and to the surrounding community through problematic drug activity and unmet behavioral health needs, including mental health issues. The health department supports all efforts to recognize and treat substance use and other behavioral health conditions as public health issues and to address social service needs that may give rise to criminal offenses in ways that avoid the criminal justice system when we can do that. LEAD offers participants an opportunity to access community resources, including physical, mental, and substance use treatment, housing, education, and employment support. Services are offered through case management and peer recovery support specialists, and participation in this program is 100% voluntary. Our health department peer recovery support specialists are individuals who are in recovery themselves, and through their shared experiences, uniquely trained and qualified to work with others in similar situations. Our peer support team works around the clock, literally, to respond to all requests for the services, and this will be another great outlet for them to assist those in need. Those referred into the program will have an opportunity to meet with a peer recovery specialist to develop a plan. Once in the program, an individual will remain in contact with their support team throughout the process to obtain health services while working to support their recovery goals. If you or a loved one are struggling with substance use or a mental health challenge, you do not need to wait for a referral to LEAD. Anyone can call our behavioral health navigation team at the health department at 410-313-6202 to help locate behavioral health resources and services. Thank you.